Okay, so this is the Seeger femoral traction splint. It's for children from birth or infancy up to about 6 years of age. It can be used for either unilateral or bilateral femoral fractures or proximal tibial fractures. Probably the main contraindication is someone who's obviously got an extensive injury in the perineal region with bruising and swelling there. This little dude has presented with a fractured femur, and he's in quite a lot of pain, so I'm going to, and his femur is quite angulated, so I'm going to attempt to apply a Seeger femoral traction splint and display that. The first part to apply is the little pelvic seat. So we just slide this up between his legs. This pelvic strap, this upper femoral strap doesn't take any weight, it just needs to be kind of loosely applied just to prevent the device moving. Just seat that up in his pelvis. There we go. Now then, there's a little latch here to slide the lower leg up and down. You want it to be sitting just below the foot when you apply the foot strap. Now the foot strap's a little bit complicated because it is actually designed to be able to provide traction to bilateral femoral fractures, but you just need to use the side with the broken leg if you only have one. You need to orientate it so the person's stepping into it like a stirrup. And then there is just some simple Velcro to do up and a little padded bit to go over the top of the foot. The next tricky question, of course, because in children everything's weight-based, is how much traction do you apply? And it's nicely written on the label, 10% of body weight, and that would be up to about 70 kilos, so 7 kilos in traction. And here, if we look on the dial, we just pull this down manually. This boy's 25 kilos, so we're going to pull it down till we get about 2.5 kilos of traction. That's perhaps one click too many. Yeah, that looks about right. His leg's a nice position, and it's taken some of the angulation out of the fracture, so hopefully that'll work. Now, another really important part of this is to give this child some definitive pain relief. So to that end, we'll now perform a femoral nerve block, which will be ideal before he goes to imaging.